It's official. NACI, Canada's Advisory Committee on Vaccines, now says people over 80 should get a booster shot, and others may be offered one too if they've been fully vaccinated for over 6 months, including those in their 70s, anyone fully vaccinated with AstraZeneca, adults from Indigenous communities, and some frontline healthcare workers.
Really, this third dose is to strengthen the protection.
But they're just recommendations. Provinces ultimately decide who can get a booster and when. In Alberta, the Northwest Territories, BC, and New Brunswick, shots are already approved for some of those groups and beyond. Ontario says it'll expand eligibility next week, but it won't likely go as far.
I think they're going to align with NACI for the time being. There's no need to do the general population yet.
Canada's Chief Public Health Officer agrees.
Right now, the vaccines are still performing really well against severe outcomes and for the most of the population.
That's exactly what the latest data shows. So far, 95% of people hospitalized with COVID-19 and roughly 93% of deaths have occurred in people who were not fully vaccinated. As for why boosters are being offered at all,
I think it's kind of like a better safe than sorry. It's better to give a booster a little bit earlier rather than wait till it's too late.
Studies show different arms of the immune system are protecting people against severe disease for at least 6 months after an mRNA vaccine. Other preliminary data is showing 8 months.
But what boosters are going to do is they're going to prevent or reduce the chances that you'll even get infected.
Which has some questioning whether the goalpost for being fully vaccinated could eventually shift to 3 doses instead of 2. Dr. Teresa Tam says while there's nothing in the works, it has been discussed. Christine Birak, CBC News, Toronto.
For some analysis, let's bring in Dr. Samir Sinha, the Director of Geriatrics at Mount Sinai Hospital in Toronto. And Dr. Sinha, how do you feel about the NACI recommendations?
I'm thrilled with NACI's recommendation today. It really has been following the science throughout the pandemic. And what it shows that in Canada, in our specific circumstance, this is the right time to start giving booster shots to older adults and other high-risk populations. So NACI's been following the science, and this is the right time to make this next move.
One of the things I wondered about when I saw those recommendations is that for people who have had 2 doses of AstraZeneca or 1 dose of the Janssen vaccine, they're eligible for a booster shot. What does that say about those vaccines?
Those vaccines are excellent vaccines. And the people who aren't vaccinated are the ones who are actually having most of the troubles. What we do know now is that an mRNA vaccine mixed with those regular vaccines gives them as well extra special protection. So this is why this is actually a good recommendation to follow, because it's grounded in the science.
We have just about 15 seconds left. For the people who aren't in those groups announced today, when can they expect boosters?
I think like BC, they're saying probably in the new year, and I think that's probably coming. But again, we want to wait till we have the science to say that's a good move for all of us.
Dr. Sinha, thank you.
Thanks for having me.